some way to, and imagine how much government's going to get into the federal government's going to get into our lives. If we just uphold these enumerated powers, and hopefully you'll pick it up, the income tax is only like maybe 40% of the total expenditures. If we got down to, we're talking about 10% of what we're spending now. And the big lie I keep hearing over and over again, oh, the government prints the money. That's a bunch of BS. Go to my website, Peter James 2012, watch the Money is Debt video. The government has to go hand and beg the bankers to loan them money, and the last time, and we can, Congress can issue the money from the Treasury. The last time Kennedy tried that, he was dead in 6 weeks. But that's a solution. We could go and issue money, at least we wouldn't be paying the interest on it. But find out how money works. It's amazing.
I'm going to keep this simple, all right? I support fair tax or flat tax. I've looked into both of them, and both of them work fairly well. I have to do a little bit more research on it, but either one would work really well. The flat tax, the fair tax, I'm leaning a little bit more towards the fair tax. And, Mr. Moderator, I'd like to reserve the remainder of my time for another question. I don't think it works that
I think like every other tax policy, there are nuances about it that I disagree with. What I will support, what I will say I support, is fair taxes for everyone. That means everyone pays their fair share. That we don't have loopholes that allow people to sock money away or send it offshore or do other things that don't contribute to our tax base. And I know that might not be a popular position to take, but I think fairness and parity and equity for everyone is what's going to allow our tax base to grow. And I'll close by thanking Rob and Victor for not calling me out when you started to talk about Rob and John. Thank you very much.
I too support updating and simplifying our tax code, whether it's a fair tax or a flat tax. I think we can have an honest debate on that and pick one or the other. Look, a fundamental principle of economics says people respond to incentives. And right now there's no incentive to do business here in the United States. There's no incentive to bring jobs here in the United States. We have the second highest corporate tax rate. We have incredible regulatory and bureaucratic red tape to do business here in America. That's where we need to focus. That's how we get this economy turned around. Look, the government only creates more government jobs. We don't need more government jobs. We need private sector jobs. That's where the growth comes. That's where our future rests. I think a larger issue here is spending and consumption versus savings and investment. The reason why this recession has been so painful is because 2/3 of the economy is based on spending and consumption. We need incentives in place to promote savings and investment. Thank you.
Now a question that nobody has an opinion about, Obamacare. If Obamacare is repealed by Congress or struck down by the Supreme Court, how would you address the insurance company's policy to deny coverage for pre-existing conditions? And I just should add that somebody else asked, what would you replace Obamacare with? The two questions about Obamacare.
I support the repeal of Obamacare, and I support replacing it with free market principles. I believe that the consumer knows what's best for him or her. I believe in supply and demand. Free market principles always ensure that a product or service is offered at the lowest possible price and at the highest quality. We don't have free market principles in our healthcare system. This is why we have runaway healthcare costs. I don't support the mandate in Obamacare. I think it is an overreach of the government. And again, it goes back to too much government in our lives. We don't have free market principles in our healthcare. They are monopolies. We should be able to buy health insurance from any company, anywhere in the country if we want to. The consumer knows what's best. Thank you.
I'm going to be one of the people that votes to make sure that it doesn't get repealed. Because I think it's important that everyone have access to health care in this country. And we'll disagree on that. Again, everyone in this country should have access to health care. We shouldn't deny people access to health care because of pre-existing conditions. I look at this room, and many of you in here are women. And as a woman with a uterus, technically you have a pre-existing condition. And that is something that will prohibit you from having access to health care as defined by many of these privatized insurance companies. I'm going to make sure that people that want access to health care do have it. And I think it's important. I think in 20 years we'll look back and we'll kick ourselves and say, I think we made a mistake, and I'm glad that we have access for everyone.
All right. Like I said, no opinion.
I don't think anybody up here would argue that we have to repeal Obamacare. Except for we'll get on a break there. Free market and free enterprise, free market principle. If we open up the healthcare system is opened up, that you could buy insurance in New Jersey from a company in New Jersey. You can buy insurance from a company in California. You can buy insurance across state lines. That'll go a long way once Obamacare is repealed. Pre-existing conditions. Right? A lot of insurance companies today, some of them will cover pre-existing conditions, and they'll move forward. Healthcare accounts for 1/6 of our economy. 1/6 of the economy. Administrative reform in healthcare, administrative overhead of healthcare accounts for another 1/3 or more of the cost of healthcare. We have to repeal Obamacare. It is the greatest move towards socialism that this country has ever taken. And the mandate is the biggest one yet. If the Supreme Court rules that that mandate is constitutional, and they're not ruling against Obamacare, they're ruling against the mandate, we will be bound to pass the microphone on to the next person.
First of all, going back, you know how I'm going to vote. There's no constitutional authority. And if the Congress, if the Supreme Court decides that they're not going to overrule it, then I'm going to raise the muster in Congress and get them to invoke Article 3, Section 2, where Congress has the ability to regulate and make exceptions to the Supreme Court. And Congress is too darn chicken to invoke that. And that probably has been 70 years. So I'm going to get them, and I'm going to tell them, if you don't come up the muster and follow your Constitution, I'm going to go campaign in your district to get somebody who will uphold the Constitution. Now, one of the problems we have on a local level, and you've got to get after Gargiola, who's the head of the healthcare committee. He was a healthcare lobbyist for 12 years. We have a monopoly, a hospital monopoly system in Maryland. It's 27% more expensive to go to a hospital in Maryland than the national average. We also have a duopoly between Blue Cross Blue Shield and Aetna. That's a battle that we have to fight here. Thank you.
I'd vote to repeal Obamacare and also to uphold those viewpoints of those that want to strike down the individual mandate. As for pre-existing condition, I believe in honest disclosure of conditions. I don't think someone should get something for free because they're not disclosing what their situation is. And if we have a competitive health insurance industry, then, in full disclosure, there will be some who charge a little more to serve those that have a pre-existing condition. But I also believe in starting good health care for the young. That includes daily exercise, that includes good health habits, that includes eliminating the use of cigarettes and illegal drugs, that includes proper diet so we don't have obese kids and later on have greater health problems.
That sounds a lot like Michelle Obama's Let's Move project. Healthcare is not a right. Candidate Little, pregnancy is not a disease. I don't believe contraception should be part of healthcare. I believe in free market principles. And actually, let me back it up. Happy anniversary. This is the 2-week anniversary that Obamacare was passed. It does need to be repealed. It's unaffordable, it's unconstitutional, it's unworkable, And it's unprecedented in the mandate, the individual mandate, the far overreaching power the federal government is trying to take from us. Like I said, I believe in free market principles. We need to allow folks to tailor their own plan based on their specific needs. And if they have to pay a little bit more, they have to pay a little bit more, but insurance companies should not deny anybody health care. We need to enable folks to purchase plans outside state lines that promotes competition, drives down costs. We need tort reform to prevent frivolous lawsuits so doctors don't have to fear about getting sued. And we have to enable folks to have portability with their health care. So if they lose their job or they quit their job and move on somewhere else, they can keep their plan.
You've heard lots of things that need to happen. Yes, I would vote to do away with Obamacare. But let me also share with you another story. I'm a success story of this health system. I had cancer many years ago, 1989, and because of the success and the best healthcare system in the world, look at what we have. Why is it that people from across the seas who can't afford to come here for treatment? They come here to the University of Maryland, Hopkins, Anderson Cancer Center, and everything else. So we can't do something, which Obamacare does, which throws out, that's the proverbial baby with the bathwater. Are there modifications that have to be done? Yes. Here in Maryland, we have the highest number of mandates that we tell insurance carriers they have to offer. That can't be. We have to reintroduce the consumer in the healthcare decision process. Yes, malpractice reform is a big part of it. Defensive medicine is a big part of our process now. You don't believe it, 2/3 of the staff in orthopedic surgeons never touch a patient.
Most Americans haven't noticed, but in the House we're dismantling Obamacare one brick at a time. Today I think we Last night we repealed, that may not pass the Senate, it wouldn't get the president's signature, but letting people know what would happen if you put Republicans everywhere down there, it will happen. Last night we passed a bill that repealed IPAP. This is a rationing board that passed overwhelmingly. Very few voted against it. So today we combined that with a less popular tort reform. We thought it might not pass, but it did. It passed with quite a few excess votes. So we're dismantling Obamacare one brick at a time. I think you asked about pre-existing condition. No, you cannot reduce the cost of health care by refusing to pay the cost of health care. If they don't insure for pre-existing conditions, they will get health care. They go to the emergency room. Somebody pays for that. The insurance premium that you pay is bigger because they did not insure people with pre-existing conditions because they got to pay for it anyway. The hospitals and clinics cannot operate at less than cost, and so they charge that to the people who can pay. It ought to be included in every insurance policy. If everybody did it, it would be okay.
Well, I would vote to repeal Obamacare, even in spite of my pre-existing condition of being a woman. I agree really. I do agree with most of the people up here about Obamacare, but I will say that the congressman has been there 20 years and he's had plenty of time to address the issues that led to Obamacare, and these issues have not been dealt with. So to say that we're passing this or passing that, how did we get to this point in the first place? I'll share with you a quick story. I went up to Canada this year. My daughter is a soccer player. I had firsthand experience with their government-run health care in Canada. I spoke to a lot of people. They are extremely unhappy. You can't get a doctor unless you've had that doctor for 20 years. If you get strep throat, you have to go to the emergency room. You cannot find a doctor in Canada that will treat you. So this is a serious situation. If you want something done, you send someone who's a driver, not a passenger. It's Kathy Afzali, kathyforcongress.com.
I thought you were going to do the and there for a second.
Next second, would have been.
Yeah. Well, by my clock, we're very close to 8:30. Can we please give the candidates, all the candidates, a quick round of applause? You obviously have more questions. This was the stack I didn't get to. The candidates will be hanging around, so please approach them, talk to them, they'd love to. I'd like to thank everyone for attending tonight. Thank the candidates, Peter, David for sound system, over-modulated sound system. It was not his fault. We had technical difficulties, but we got through it. One quick thing, I would like to ask Linda Evans, who organized our last two forums, to come up here and get seen. Linda, would you come up, please? Linda took the lead on this for the Tea Party, and she worked very, very hard. Also, thanks to her husband, Wilbur, for putting up with it. And she did a real fine job. And the board directors pitched in among ourselves and got a little token of our appreciation. I think it's McDonald's.
I didn't expect anything. It's been fun to do, and I've enjoyed getting to meet everybody, and I look forward to more events in the future. Thank you.
Don't forget your straw ballots. You can place them in a box at the back of the room. And if you would please, it did cost us a few dollars to put this on. So along with your straw ballot, there's a donation box back there. If you could put a little something in that, we'd appreciate it. All right.